So the study looked at practice patterns in New York State. So what we did is we analyzed the database from New York State called the Sparks database, which is interesting because it's a database that encompasses all payers, so not just Medicaid and Medicare, but all insurances as well. So it's a very powerful database for that reason. What we did is we basically looked at robotic and laparoscopic surgery procedures, specifically robotic procedures that were being done in the last 5 years from 2009 to 2014. The reason we chose those years is because prior to that, the ability to mark whether or not a procedure was done robotically is much more difficult. So it wasn't actually being done until late 2008. We chose 2009 because it had been permeated enough inside the database to be able to identify exactly where, what procedures were done robotically and which weren't. And what we were looking at was looking at the larger inpatient stay type of procedures that are being done in not only urology, but in other fields as well. So that included things like urology, gynecology, general surgery, thoracic surgery, orthopedic surgery. And specifically, we looked at 6 different procedures and looked at also the demographics of the patients receiving those procedures and also the physicians doing those procedures. During that time, we saw a major increase in the procedure volume on all areas that we're doing robotic surgery. So that includes gynecology, it includes general surgery, it includes cardiothoracic surgery. Urology, interestingly enough, had already started to taper off. And I believe the reason we saw this is because urology has been doing robotic surgery since the early 2000 time period. And so we're already starting to see sort of a permeation of the care or the health of or the use of robotic surgery in all areas of surgical procedures. What we found is that especially in the newer sort of disciplines that are taking up robotic surgery, there's sort of a skew of who's getting the surgery and who's actually doing the surgery. I think we have to be a little careful by saying that we're creating sort of I guess a racist or gender biased kind of procedure here. I think what's happening is that especially that new procedures are being taken up or being sought after by patients and young physicians trying to make their name in these procedures. For instance, general surgery, gynecology really have only started using this technology in the last 5 to 6 years. It's starting to permeate itself on the internet, advertising. So who tends to seek out these type of things that are sort of new gadget type of procedures, new technologies, really men in general, and I think there's sort of a gender bias just for that. Men also like to use computers and like new technology, and so for the same reason, surgeons are also looking to start using these procedures. Again, when we look at our study, we looked at all these different disciplines, but if we dial it into each specific discipline, so for instance, urology versus gynecology versus cardiothoracic surgery, we start to see these kind of big differences starting to slow down, especially in urology, where, for instance, robotic prostatectomies, 85% of these are being done now robotically. So we're starting to see an even distribution now from all different sort of the patient backgrounds who are receiving it. In gynecologic procedures, obviously mostly women receiving it. Almost 50% of all hysterectomies are being done robotically. Same sort of idea. We're starting to see much more sort of an even distribution of who's receiving those types of procedures. While the other disciplines, we're seeing a lot less uptake, meaning or less permeation in general. So we're talking 10%, 15% of all the procedures being done, and so therefore we're still seeing these larger skews. I think that has to do, again, with the type of technology or new technology that's being taken up by younger surgeons, surgeons who are willing to experiment or try out new procedures. Can I explain why there's more white males than other males doing these surgical procedures? No, I can't explain that right now, but certainly I can explain the gender bias.